Mental health services in Ohio are facing a severe lack in representation from people of color, according to a new report. Health experts believe this could lead to increased disorders and suicide rates among minorities. NBC4's Jonathan Jackson is live at the State House tonight with how these disparities are affecting Ohioans. Jonathan?
Yeah, guys, studies from mental health advocates show that our racial disparity among those in our mental health field does not reflect the population here in Ohio, and it's something that they're bringing to the attention of state lawmakers. A new report by Ohio researchers reveals a severe lack of racial diversity in our state's healthcare system. The researchers behind this study are from Ohio University, Central State University, the Mental Health and Addiction Advocacy Coalition, and Multi-Ethnic Advocates for Cultural Competence. Through data analysis, they found around 12.5% of Ohioans identify as black, but less than 5% of psychologists and psychiatrists in Ohio are black.
That lack of diversity, not just in terms of race and ethnicity, but in terms of gender, is a problem that we have to change.
Jewel Woods is the founder and clinical director at Male Behavioral Health, a Columbus-based practice that provides mental and emotional support toward men seeking therapy. He says clinical research shows the need for increased behavioral health services in communities of black, indigenous, and people of color, or BIPOC.
But what we find, unfortunately, is that minorities, particularly African Americans, and even more particularly African American youth, just don't feel comfortable even accessing the mental health resources that are available because they feel as if the clinicians there don't understand them. They feel like they might be targeted, and that ends up, unfortunately, just increasing the disease burden.
It's why mental health experts presented their findings today at the State House, calling upon lawmakers to expand training around cultural competency, increase financial assistance towards students of color, and improve access to behavioral health services.
We need to be looking at pipeline issues, recruitment issues, and also retention issues. So it's really critical that we have the cooperation and support of this body to be really impactful in the work that we're trying to do.
From 2010 to 2020, there was an 87% increase in suicide deaths among black people in Ohio, which is why advocates here say these issues need to be made a priority in Ohio. Local for you at the State House, I'm Jonathan Jackson, NBC4.
Jonathan, thank you. If you or anyone you know is struggling, there are resources available. Call the National Suicide Prevention Hotline. The number on your screen, 988, or call the Ohio Suicide Prevention Foundation, 614-429-1528. You can also find these numbers at NBC4i.com.